More questions are being raised after another case of the new variant of the COVID-19 virus was detected in Southern California. There are also 2 cases in Colorado.
Yeah, they're looking at Delaware, Massachusetts as well. Joining us now to talk about the new strain is Dr. Michelle Prickett, a pulmonary and critical care specialist at Northwestern Memorial Hospital. Doctor, always great to talk with you. Thanks for taking the time. Let me start with your assessment now that the vaccines are rolling out, and then I want to talk about this variant strain. But how are you feeling now that the inoculations are actually happening?
I mean, there's a little sense of relief. So I had my vaccine last Friday, so I'm about 10 days in or so and feeling well. So I had a little bit of pain, some fatigue. That's been the standard of what most of my colleagues are reporting, but we have a little bit of relief, but we know that we're not fully vaccinated until 2 weeks after our second dose. So we're still waiting and we're still vigilant.
Okay, a lot to come. I want to move now to this new strain. We heard about it when it popped up in Britain, in the UK, and then now we hear of this several cases here in the US. How concerned should we be? How concerned are you at this point?
Well, I think we knew that the viruses can all mutate, so this was not shocking. It also provides us a wake-up call to remind us of the importance of keeping ourselves safe through the methods that we know help. So wearing masks, social distancing, washing your hands, staying home. So what we don't know about this is if it affects disproportional portions of our population, or if it changes severity. So far, it does not appear to cause an increased severity of illness, and that's a very good thing.
Okay, so we know it is not necessarily more severe, but it is definitely more contagious. My question is you said it's a virus and they mutate, just like the influenza virus. How many of these strains do you think could develop down the road, and is that something that you fear?
I think we're all aware and we all are respectful of viruses, especially ones such as COVID-19 or SARS-CoV-2. The mutations, again, these occur, and it really focuses on not having it spread between humans or between patients. And so our focus when we hear of mutations is really keep the suppression down, keep transmission to the lowest possible levels so that we don't have further mutations.
You know, a week ago, Dr. Fauci said that this new strain is already here, and in fact, we've seen these several cases. I think the question now becomes, how widespread is this new strain here in the U.S.? And I don't know if you can offer some insight into that. What are you thinking? What are you guessing at this point?
Well, I think what we know so far from the strains that have been identified are they have been associated with community spread. So they weren't related to travel from an endemic area. So this is likely within the community and likely has been spreading for several weeks, if not longer. We know that the first backtracking of this mutation in the UK went all the way back to September, but didn't become problematic or really show itself until November. So the likelihood of that this is within several states within the United States is probably fairly high.
We understand that the vaccines should be effective on this variant strain and others that may follow. Do we know how it affects children? Is it any different in the younger patients?
Right now, there's not enough data to suggest that it's affecting one age population. It is currently being studied in the UK in that population where it's most been identified, but we don't know its effect on children yet.
All right, a lot still to learn about this. Thank you so much to Dr. Michelle Prickett with Northwestern Memorial Hospital. We appreciate your time always. Thanks. Happy New Year.